changed routine, or even the fear of unknown and uncertainty that prevails around adults as well as children. Now, this is where it can have a profound effect on social, emotional, and cognitive health and the development of these aspects in a developing child, especially the young and early childhood days when the development is really rapid across these domains. Now, the environment that we see as changing across ages could be at the community level, or could be at the family level, or at the level of the child itself. Now, the pandemic, as we know, is growing across phases, and mental health issues are likely to emerge in children, which may affect their normal social, emotional, cognitive development. And so it is important as caregivers, as researchers, or as professionals to be sensitive about how these children are able to understand and respond to these stresses or the change in psychosocial environment, and maybe find some ways to create safe spaces so that there is reassurance and some kind of regulated routines for children to get less affected by the stressful situation that we are in. Now, the environment that this pandemic creates particularly affects children who are not only those who are typically developing children, but also the ones who are at risk or suffering from chronic clinical conditions. So we would be focusing on three aspects today, and which is social, emotional, and cognitive well-being. I'll just briefly say what we mean by each of those. So the impact of this pandemic in the social domain could be due to the way the communication patterns have changed, the fact that we are practicing social isolation for a very long time, the vocabulary that has changed dramatically in terms of the frequency of use of the words which are negatively loaded is more. So all of which may encourage avoidance behaviors more and approach behaviors less. And not only that, the social perception, how we interact with people and understand what is going on in their mind, these opportunities are less. So I'm expecting that there would be some kind of gradual changes we may see even with respect to face perception or emotion detection or gaze processing, or if you just go up to the theory of mind development. The emotional domain, definitely, because it's a stressful situation. So emotional reactivity is higher. And because of that, the ability to regulate emotions may be affected. And this is something which also takes a toll on cognition, because once we are engaged mostly in regulating our negative affect, we exhaust cognitive resources. So there are studies which show, and this is mostly with adults, which show that there could be an effect on cognitive efficiency of a person if emotion regulation is mostly involved in managing negative affect. So that is one. Now, the point I want to make here is that we are talking about these three domains not as individual effects that we would see, but as correlated effects. And today we will see how we discuss about the connection between social affective health and cognitive health, and how is it going to shape the experiences of a child in the current context. And something which I think I would like to raise later in the discussion is that whether this effect is going to be long term, whether we expect developmental changes, because that would be something really major to look for. And I just found out that there's a study going on, a longitudinal study going on at the University of South Wales, Australia, Sydney, Australia, where they have actually launched a study which is ranging from 11-year-old children to 65-year-old adults. And they're trying to look at the social affective and cognitive issues over time during the pandemic longitudinally. So they expect that this whole scenario of social reorientation, which is what the child has to actually learn, that how do you reorient yourself in the social context and still keep learning and acquiring information. So that is going to be the cognitive challenge that we have. And I would like to term it under one umbrella term, as you can call it, adaptation. So this could be more like, how do you relate to the change that is there? How do you confront it, and how do you cooperate with the environment which is around you and the others who are also facing a similar kind of a stressful situation? So the positive thing is that, I mean, this pandemic phase has not only led to negative consequences, but has had some positive consequences as well. But since there are these phases of lockdown, then unlock phase, and then there could be a post-pandemic phase, the challenges may vary across, and we will see how it comes up during our talks. So the only point here to make is that one, that we have to be aware that which specific issues are these that we need to worry about as researchers and as professionals. And we need to be sensitive to how to understand and respond to the stress experienced by children, their caregivers, and how we can find more constructive ways of building resilience in all these three domains. Now, with this, I'm happy that we have the three very eminent speakers on board. Professor Nandini Chatterjee Singh, who is a cognitive neuroscientist, and she's a senior project officer at present at UNESCO, Mahatma Gandhi Institute of Education for Peace and Sustained Development at New Delhi. Professor Singh's research is focused on learning in the context of literacy, emotion, and music. And as we can see, they are all related or connected closely. She leads the Rethinking Learning Program at MGIEP, focusing on skills of intellectual, social, and emotional learning, as described by the SEL framework. And she calls it EMC2, which is empathy, mindfulness, compassion, and critical thinking. And this is something where she's trying to develop interactive experimental tools on the digital platform. These are AI-based tools like games, dialogues, videos, podcasts, and these are designed for adults and children. I'm sure we will learn more when she talks about the social emotional skills and their role in learning and development of human well-being. The second speaker we have on board is Dr. Madhuri Mangathi. She is heading the Department of Psychology, Ashoka University, and her expertise is in the area of developmental science. She is one of the few researchers who works on infant cognition in India. And her focus has been on looking at patterns of growth and development in children who are at risk or children who are typically developing, but mostly restricted to infants and early childhood. She has been involved in validation of language assessments in preschool children, functional capabilities, temperament, and she's also interested in creating interventions using protective factors framework to mitigate the effects of risks arising from early adversity. So her talk would be mostly about how we can look at the effect of pandemic on certain cognitive aspects from the perspective of the parent, the child, and the researcher, and she would like to connect these three perspectives in her talk. The third speaker we have is Professor Srinivasan Venkatesan, who's heading the Clinical Psychology Department at All India Institute of Speech and Hearing, Mysore. Before this assignment, he was a faculty at National Institute for Empowerment of Persons with Intellectual Disability at Secunderabad. He has multiple articles and books to his credit. He has conducted about 300 workshops on topics related to children with special needs. And as an alumnus of NIMHANS, his doctoral work has been on neuropsychological battery for adults with intellectual disability. Today, he will be looking at the more clinical aspects, and that is to do with the children who are suffering from chronic clinical conditions, the developmental disorders, what kind of challenges they would be facing in this pandemic phase or they are facing, and how the post-pandemic period should deal with them. So he may be touching upon some of the interventions as well. So I would now request Professor Nandini to go ahead with her talk, and we will learn about social, emotional, cognitive health of children in this pandemic, especially those at risk. Oh, this is Dr. Venkatesan's slide, I think. So Professor Nandini, you will be talking about the role of social emotional skills in development of well-being, right?
Right.
I think screen sharing.
Sharing, I would request Dr.
Nandini, you need
to
Dr. Venkatesan, please minimize your screen. Yeah.
Thank you very much. Hello, everybody, and these are interesting times and interesting ways of sharing information, but we all continue to learn and grow.
Yeah.
And so what I will plan to do today in the next 18 to 20 minutes is to quickly walk you through some of the basics of social and emotional learning, which I think become relevant for the conversation, and then link this to the role of learning and development. And a particular thing I want to emphasize on is that the pandemic situation has probably brought to fore the value and importance of social and emotional skills. But to be fair, this is something that we actively need in schools today, in
Yeah,
development today.
true.
So whilst the pandemic has only pushed it to the top, I think it's very important and relevant that we actually think about this most strongly in our school situations.
Sure.
So just to step back a little bit and look at what we know about social and emotional learning today, and we're at that point in history we actually know enough about the social brain and the emotional brain, and begin to see their role in human behavior, and not only as individuals but as collectives. And one factor that has emerged very strongly from the field of social cognition is the fact that humans are social beings. We have an innate ability to form and develop interpersonal connections. And these social bonds, which are formed very early in life, create the foundation for all of us to exist in and across groups, and are vital to the human experience. To the extent that, excuse me, just a second. Sorry, I have to make sure the internet didn't get blocked off by a door. Um, and we are at that stage today where people are actually beginning to think that during the time of the internet, even more than academic skills, what we need to focus on are social and emotional skills, because these form the bedrock of human existence and human relationships and human well-being. We also know now from a lot of advances in social cognition and the neurosciences that humans are born with not just psychological but internal biological systems which are tapped in to address closeness. Yet at the same time, these are the same neural circuitries that are also activated in times of perceived threat or danger. And therefore, the sense of identity that we begin to build into ourselves, and especially as children, becomes crucial, that we need to build in safe spaces so that we can come in from a safe space even whilst interacting with another. And we now know that social and cultural interactions not only contribute to physical and psychological development, but are also the primary factors which mediate cognition and learning. And so, if you go back and look at Pat Kuhl's work on how language develops amongst children, it's actually through a lot of social interaction. And now we know even counting systems, algebraic symbols, even the development of maps and the creative arts have emerged out of our interactions with others. Okay, and the social process becomes a very crucial factor in learning almost anything. So even starting out from soon after birth, when children begin to form attachments to as they grow on to interact with the wider world, and then as adults form identities of their own and form groups and relationships, the social emotional bond that begins to build in plays a critical role whilst development and as interactions. And I think all of us have experienced this at multiple times when we have left our homes to go out and find new identities in the world, and at different stages of our lives depending on experiences. And I think this would be an incomplete session if we didn't go back and refer to the work of Vygotsky, where he very clearly establishes a distinct role that rather than what was initially proposed in the West in terms of learning developing in isolation, but to the fact that learning is actually building a relationship with the teacher and the potential of what a person is capable of. So the fact that you can go from independent functioning to your potential of development is essentially building a bridge with your teacher. And so building that bridge is actually a means through which the teacher or the caregiver will be able to communicate and grow with you more complex ways of knowing. And this continues to be a much researched and addressed theory even today. And learning in this context is something that I think is pervades us all the time, not just in our childhood. But social relationships, as we now know from brain structure and connectivity, are all mediated through emotional responses. Okay? And so the main purpose of emotional literacy really is to develop a skill such that we understand and name our own emotions and thereby also recognize the emotions of the other. Okay? It's one of the reasons why recognizing emotions in faces is so critical and important to even our daily healthy lifestyles. Okay? And these constantly come into play to improve relationships, build cooperation as we go along in life. And since I'm going to come back to some of these areas again later in the presentation, I wanted you to play a little bit of focus to the fact that highlighted here are regions of the brain that are involved in social circuitry as well as emotional circuitry. So the social and emotional circuitry is very closely linked. And what you probably are also seeing is that the limbic cortex is clearly anatomically connected to the prefrontal cortex. And therefore, every decision that we make is impacted by the emotions and the feelings that we experience at that time. Okay? And this is an anatomical link you cannot do away with. But what we now know is how this link can actually be built up and is malleable. It's not something that you are born with, but just like you can teach children skills of literacy and numeracy, you can actually build skills of social and emotional learning. And that's one of the reasons why social and emotional learning need to make an active entry into education. And just before we move on to what we do precisely on this in terms of NGIP, I want to take you to this study that was published in 2017. Okay? And it really reflects the interconnected world of today, not just in everyday life, but even across the globe, okay, across the internet. So on the left in blue and red is a figure from a paper by Brady et al., which is a network graph of moral contagion, okay, shared by political ideology. So the nodes are represent a user who sent a message. Okay? So these were all messages that were sent on Twitter. It's an analysis of messages sent on Twitter. And you can see how densely people who have similar thinking connect to each other. So look at the connections that you make within the blues and within the reds, as opposed to across them. Okay? So the two communities, which is really the conservative and the liberal two readerships that are that people are really looking at right now, represent two different ideologies. And based on their ideology, they retweeted a message. Okay? And so you tend to retweet a message that you actually agree with much more versus retweeting a message that you don't agree with in terms of ideology. The numbers are much smaller. Now, this is to some extent a little worrisome. Okay? It is important for us to recognize that understanding perspectives of others, even if we disagree for them, is something that is crucial for us to live together as a society. And there is a need now to build capacity such that you can have empathy even for an individual you might not agree with. And this really goes on to form the basis of social emotional learning and social emotional competencies. Okay? So you might have conflicting views. And because we know that these social views might lead to emotional responses, we need to accommodate and be flexible enough to accommodate those different responses and make sure we regulate our emotions to react appropriately as well as take decisions appropriately. So next time you're in an interview meeting where you're interviewing somebody new to come in, I think that's something important to keep in mind for all of us. You might not agree completely, but that's also probably an equally accepted point of view. Yet at the same time, how important it is to be able to continue to make sure that you have a logical train of thought. And this is something that I will come to in a minute. So broadly, social and emotional learning, and this is probably the most well-known definition of social and emotional learning that exists today and was put forth through CASEL, which is an organization that was set up about 40 years ago, which started talking about social and emotional learning. And it's the process through which human beings acquire and interplay and apply the knowledge of emotions and skills necessary to understand emotions, achieve positive goals, feel and show empathy for others, maintain positive relationships, and make responsible decisions. A number of other frameworks exist today, and I will talk about one more, which we feel is a more basic framework. But I think you realize that the different components that include are social cognition, emotional regulation, empathy, but action to ensure that positive behavior or positive outcome is maintained. So something that Bhumika referred to earlier is something that we use a lot in building social and emotional skills, and that's the theory of mind. Okay? So the power to mentalize is something that is very crucial for humans, and we use this extensively. And therefore, the better we understand ourselves, the better we'll be able to understand the other. Okay? So the ability to understand fellow emotions and thereby to also recognize intent and their own mental actions becomes crucial for us. This is a very important trait that Tomasello talks a lot about and which is seen even in chimpanzees and is sort of grown across evolution. But this is an extremely important trait which some of you might be aware is something that is impaired to some extent in autism spectrum disorder, for instance. Okay? And therefore, this is a crucial trait which comes into play during social and emotional skills. A second trait, which has, in fact, is now no longer a trait, but is now encouragingly becoming behavior because it can be taught, is pro-social behavior. So the need and the want and the desire and the intent to improve another person's life without necessarily being egoistically motivated. Okay, so it's not because it may improves me, but because it will bring forth improvement in somebody else's state, is something that is encouraging, being encouraged even more. And the reason for this is it's actually a double whammy. In the process of doing something good for somebody else, we now know from the neurosciences that you actually activate reward circuits within yourself. You feel just as happy doing something for somebody else as you would when you ate a good meal or had a bar of chocolate or did something fun or listened to good music. So you end up feeling good when you do good for others. Okay? And that's emerging very strongly as something to be encouraged for a more positive and happier world. I want to come back to this trait or to this aspect of pro-social behavior later on when we begin to talk about what are the competencies that we want to encourage in such times of COVID-19 crisis. The pro-social behavior aspect becomes very important to be able to reach out to do something for somebody else. And that ends up by alleviating your own panicked or anxious state. And finally, the need to build and promote positive emotions and build resilience. Okay? And I think the idea of emotional resilience can not be overemphasized. We are just seeing too much of it reported today because of the lack of it and what it is leading to these days. So positive emotions have emerged very strongly in the last 20 years as markers of human flourishing or well-being. And they're worth cultivating because not only are they good end states, but they can be recalled in times of anxiety and panic. Okay? So here is another idea which can be brought into perspective when one is in anxious states as brought about by the current COVID crisis. Okay, recalling those happy memories of past times good together shows and has the capacity to be able to improve your current state of mind. And therefore, the notion that you must cultivate these positive emotional states is becoming increasingly important. This also helps of recovery during negative events. Okay, and Bhumika talked about how the use of negative emotions has increased these days. But if one can begin to take a positive approach and build back more use of positive emotional of wordings and semantics, we actually have a chance of altering that state of anxiety that might begin to quickly pervade during such times of crisis. So to very briefly tell you, at MGIP, we are in the process of trying to mainstream social and emotional learning and education. And in order to for it to have a large impact, we are using digital pedagogies as much as possible. I'm just going to leave it at that for lack of time. And uh, the, the framework that we have come up with is called EMC square. So each of these are distinct competencies that can be cultivated in the brain. So all of these are malleable and can explicitly be cultivated. Empathy includes not only the ability to recognize emotions, but to also understand the perspective of others. Mindfulness is the conscious bringing of attention and awareness from the outer to the inner to be able to use the sensory modalities very effectively to be able to calm the mind. Compassion or pro-social behavior or karuna, like we are all familiar with, to actively practice it. And just as you brush your teeth, I've heard Richie Davidson say this, just as you practice brushing your teeth and do that every day, make it a habit to engage in a compassionate act every day. And that's something you can fall back on at the end of the day when you're going to bed, to make sure you go to sleep in a healthy, happy space rather than worrying about all the things you didn't get done in the day. And finally, critical inquiry, to make sure that all the decisions that you take are rooted in evidence and in logical reasoning. So that's the framework that we've come up with. And there is a whole formalism which we think based on which this actually links to building human flourishing in education. And here is the challenge that we are facing today in children. Okay, there's a bunch of reports that show increasing depression, decreased empathy, increased mental illness, increased toxic stress, and reduced sleep, all of which really put you at risk for mental health disorders. In particular, our first set of programs focused on adolescence, and adolescence we think is a particularly vulnerable stage, because at that age, because of the changes that are happening in the brain, the limbic cortex has developed, the prefrontal cortex is still developed, and so there is a reliance of the adolescent brain to rely more heavily on the amygdala. Remember, the amygdala is something that we talked about even when we looked at the social emotional circuit. And there is reduced reliance on the prefrontal cortex, and therefore judgment or decision making is rather impulsive and can involve risk taking. And if this information is available with teachers, parents, and caregivers, they can begin to actively use this information to build more resilient conversations that can begin to happen. So we created a curriculum which has now been implemented in 7 countries. I will not have time, of course, to go into that, but it's motivated by the 4 competencies I talked about. It uses a lot of advances in technology in terms of bringing in interaction, getting people to get into situations where they can actually name their feelings, recognize how these feelings are part of the classroom, and realize that they need to be able to manage those feelings if learning has to happen. So it's really a very simple process that happens there. If you are anxious in a classroom, your brain is going to be engaged in trying to remain or resolve that anxiety and is not able to focus on the learning that's happening in the classroom. So how do you address this? So we've been doing some data collection across different countries and mainstream these competencies into curricula. So imagine if you were doing a math or a science class where you actually paused in between to discuss these aspects too into your classroom. And what we've been able to find is that even across a 12-week course where you have a curriculum which embeds SEL competencies too, you're actually able to see changes in children. And the one thing which excites me the most is we found very low levels of self-compassion in adolescents, which after such a curriculum actually showed a difference. We also use a lot of gaming around where we use the narrative of the game to actually build a curriculum on social and emotional learning. And finally, before I wind up, because I'm probably way out of time, is a factor that I want to drive your attention to is the kind of mental states that the COVID crisis has driven us to and the fear and panic that has come in. So a whole bunch of mindfulness and emotional regulation activities are very useful here. And I want to just quickly take you to this website, which where we have collected activities from almost 100 resources which are freely available for people to come back to and look at. So go back and look for this online and you will be able to use any of these activities. They are all freely available and can come back and be part of your classrooms. We've also created a course on pandemics, which includes activities on social and emotional learning. And finally, before I sign off, on the 18th of July, which is Nelson Mandela Day, we will be launching a review, which is called Rethinking Learning, review of social and emotional learning for education systems, which reviews the most recent frameworks of social and emotional learning, and more importantly, lays out for policymakers and researchers how this could be brought into classrooms, into families, and to actually guide the development of social emotional learning programs. I think I will stop here and come back to questions later. Thank you very much, Bhumika.
Thanks a lot, Professor Nandini. So with this background, I think she has very clearly laid out what we are actually concerned about when we say social and emotional learning or social and emotional skills. And she's also shown us how we can understand in terms of the effects in the brain, as well as how it relates to the kind of training programs that can be created around it, as she enforces the fact that actually is required in the classrooms, and that would gradually build resilience, which we probably are lacking today, or we need that we have it, whether we are as adults or as children or adolescents. So with this, I think we have now clarity about what exactly we would be referring to when we say social emotional skills. I would now move to Dr. Madhuri Mangathi. She would be talking about slightly related aspects with respect to cognition, and in both children at risk and not at risk, but primarily within the early childhood days. Also, I think she would be talking about some play therapy, which she has been working around in her work with the community as well, and how community health workers join together to actually give a collective perspective of how we can connect these issues with how the child is experiencing it, what the parent can do, and what the professionals can do there. So, Professor Dr. Madhuri, over to you now. We can't hear you, Dr. Madhuri. You need to unmute.
Sorry,
Yeah.
Okay. Let me share my screen. 1 second. Yeah, can you see the screen now?
Yeah.
Okay. Thank you, Bhumika, and thanks for giving me this opportunity. Um, Taking off from where Nandini has given a very good background on how socio-emotional bonds are very important. This is extremely important because I would take you back to where it starts essentially, because a lot of my work is related to early identification of at-risk infants. A lot of my work has related, I'll give you a little perspective later on, but most of my work has been over the past 15 years has been more in terms of early identification of disabilities as early as 3 months of age. So how best can we identify cognitive and language delays earliest at as early on as possible? So let me give you a background on how we go about to address these kind of issues and what is it essentially that needs to be done to be able to try to understand um, the at-risk and not at-risk infants. Um, Bhumika, is my voice clear?
Yeah, yeah. Please go ahead.
Um, so essentially, at the moment, this is something of a constant. I mean, we're bombarded with these pictures day in and day out of how children and especially migrant families have been moving around, and this kind of contextualizes our problem from where Nandini has given about socio-emotional and learning that needs to happen at this particular stage. But what needs to happen and what is missing for these children is very important to recognize. And as researchers, as parents, as children, for children, what is something that needs to be done is something that we need to try to address at this time. Um, so we know, I mean, if you look into the, I mean, I've tried to look into some of the Twitter posts and most of um, the Facebook posts where most of the parents have been able to access and express their emotions in terms of saying that the children have been missing their emotions. So there was one parent who called up with a child with cerebral palsy recently to say that the child who was able to socialize, interact, and play well in the community has suddenly started to throw temper tantrums. Now, where does this come from? What's been happening here? So he says, this parent calls up to say that my child cannot understand the lockdown, so therefore this child is showing temper tantrums, and he's not able to. I'm not able to make him understand about this. But essentially, it turned out when we were talking with the parent that the child has not been able to go to the therapist, due to which he's been experiencing a lot of pain, and that is exactly what is causing him a lot of temper tantrums rather than missing out on play. But he's also been missing out on play because he misses out playing with his cousins who would come regularly to play with him. So these kind of missing interactions that have been very important and vital, especially so after we've heard Nandini's talk on social-emotional bonds that are there, is very important and critical for development of the child. Given this pandemic, now what would this have on the overall development of a child? What is necessary that we need to do at this time? And what we have been doing um, from the past few years in trying to address these issues. Let me walk you through what some of the work that we have been doing in terms of trying to understand mother-infant interactions. And going back, it's not only start something from children that has been happening. Let's start from infancy, where mother-child bonds are very important, where attachment processes are very important. As early as neonates, from the kangaroo care that we have talked about, and research has talked about kangaroo care being most important for for preterm infants, especially for risk infants. This kind of bonding process shapes the mother-child bond and helps the child in improving the developmental outcomes. Now, how does that improve the developmental outcomes is very important. Let me show you how this happens. This is some of what you can see. I don't know if the audio was clear or not, but this is essentially about how the mother and child interact. They connect with each of them, and mother is trying to provide a lot of the caregiving input that the mother is able to provide helps the child to understand the world around them. Now, how does the child understand the world around them? I'll come later on. But the caregiver's input to the child as early as possible, from the time the child is born, is very important. And mothers very intuitively try to embed their words in multimodal events. Multimodal, I mean, is mothers most often use auditory visual information. They kind of name and move the object around the same time. There is face voice movement that's happening around the same time. So when auditory visual information is available to the infants around the same time, it helps to recruit their attention. It helps to scaffold the processes of attending to the maternal interactions that the mother is speaking to. Especially, Nandini has talked a lot about Vygotskian scaffolding in terms of how mothers try to scaffold and provide interactions. And these interactions help to facilitate and understanding this information. But what is that information that comes from the environment and helps in building up the child's ability to learn about the world around them? The child's ability to understand, and that facilitates cognitive development and that facilitates language development. Some of this work I've been working through, and during this process of mother-child interactions or communication, mothers provide this very specific uh, process called as intersensory perceptual processes that the child is able to make use of. This comes from when the mother is able to name and move the object around the same time. Mother uses a lot of toys to the child. The toy makes a sound and the toy moves at the same time. The auditory visual information that happens in synchrony, that temporal synchrony of auditory visual information that happens, provides a lot of this invariant information to the child. Invariant information is information that doesn't change. The children, the infants are able to tap onto these amodal invariances, and these invariances are something that the child, that the mother keeps providing from the caregiving environment. The information that comes from the caregiving environment and the perceptual processes the child is able to tap into helps in helping the child understand what is the information that comes from to understand the world around them invariably. So that's why from early on, from in utero, you will see that these perceptual mechanisms the child is born with helps the infant to make sense of this dynamic multimodal information that's coming from the caretaking environment. So from utero, the child is able to make sense of this environment and comes into this world with a sense of trying to understand what the information is coming from the mothers. There are also studies which have shown that the child is able to recognize maternal voice as early as newborn. The child is able to imitate the maternal mouth movements, especially, that are there. There are very specific studies that have also shown about how sensitive the child is to the maternal singing, rhythmic patterns of movements that the mothers make. A lot of parent infant synchrony in mother infant interactions helps not only in the bonding process but helps in building up socio emotional cognitive development of the child that happens. The process is very clear, but what happens when the child, if the child is, this is very good and it makes sense for us when the child is a term not at risk baby. The child has very good sensory systems. The child is born with a very good sensory and neuromotor systems that helps the child to tap into this information very effectively. But what happens if the child were to be born preterm? If the child is born preterm, the child has an immature sensory system. Is the maternal or caretaking environment able to sensitive enough to understand this child's immature sensory system? How do mothers of at-risk infants interact with their babies? Do they understand that their sensory system of their child is capable enough to tap into their information? How far is this process happening? Because there is very clear-cut evidence to say that infants as early as 2 months of age, preterm infants as early as 2 months of age, show intersensory perceptual delays. That is, they're not able to perceive symphony at 2 months of age. Even at 6 to 9 months of age, we have seen that these children have shown word learning delays. Word learning delays meaning that much before the language comprehension happens, the child word learning essentially means the child has to map the word onto the object. This kind of word learning process helps the child to understand about the objects around them, helps them in verb learning. So, some of our studies have focused on the earliest beginnings of verb. How do babies begin to understand events and actions? How do babies begin to understand nouns and especially objects around them? How do they understand the size, shape, color, sound, all of these features around them? How does this information of intersensory perception bind all this information to help infants understand? These are studies that we have specifically done on lexical development. So these are some kind of studies, and this is the mechanism that helps babies, especially preterm babies or at-risk babies. Uh, they come into this world with some kind of immature neuromotor and compromised neuromotor and neurosensory systems, putting them at a greater risk if the maternal communication patterns are not well adapted to understand the sensory systems. So that's one of our studies that we have been focusing to try to understand. So we've started an infant lab at Dr. Arimal Hospital with a grant from Cognitive Science Research Initiative, which actually tries to map to understand what are the intersensory perceptual processes in these at-risk infants as early as 3 months of age. So we want to longitudinally track the intersensory perceptual process both from the child, but to begin with, we started to understand what exactly is the maternal input about. Do mothers of at-risk infants, how are they interacting? Are there differences in interaction patterns of mothers interacting with their at-risk infants and mothers interacting with their not at-risk infants? I can show you a video of one baby who, let me know how I can share the screen, because these are videos which I could not really download. Let me try to see if we could, um, let me do one thing. I'll do a stop share and actually share the video for you to get you to understand this mother-child interaction. Is that okay, Bhumika?
Yeah,
Do I
we
have 2 minutes
can
time?
keep
Yeah. I can
the
I
time.
can show
We can keep
some
the
mother-child
time.
interactions.
We would just request you if we can do it within the time that we have, this time slot
Yes.
we have. So,
Yeah.
yeah.
I'll just show one interaction. Can you see this?
Yeah, we can.
One second. So these have been some studies to help us understand in early identification of how babies as early as 2 to 3 months, how these perceptual processes facilitate in understanding if we can predict language and cognitive delays. This study is presently in progress, and part of these studies we are in the process of preparing a manuscript right now. We also are trying to understand what children, how do children essentially also understand language development with narratives essentially. So we are using picture cards to make children understand if the child is able to form these narratives and understand and give us a narration of the pictures, of making a sense of pictures. So we've been able to test children both in the public schools and private schools to understand how they're able to narrate a story in English and narrate the same story in Hindi, which is bilingual language. This is a study that's being conducted with another group with Natalia, who has actually standardized this tool called as Multilingual Assessment Instrument for Narratives. And this is a language study that's being conducted across the world, across 21 different languages. And we are also standardizing some of this with the South Indian languages in Telugu, in Kannada, Malayalam, and because right now I'm staying in Hindi, we've started to collect data in Hindi with 5 to 6 year old children as well. So these are some kind of studies that help us understand how these children um, language development or cognitive development has been in terms of it. But coming to the children with neurodevelopmental disabilities, we also wanted to understand what are these consequences of when the children are being cooped up with their parents and siblings. How do we understand these factors which are affected by age and home environment? And how do we to understand how this healthcare system can support the families at this point of time. So it's just not only about trying to understand what's happening and also mitigate these risk factors, but we also want to try and understand what kind of interventions that need to be planned for children. Let me give you a small framework that we have developed in terms of um, helping parents, frontline workers, and in training and recognizing the power of play, because play helps in building cognitive development. We have seen children are able, by being able to play, children's cognitive development can be enhanced quite significantly, not only in terms of the Vygotsky model of scaffolding and what comes from the caregiving environment, but child's ability to interact with the environment, able to explore the environment around them, helps us to make sense of what is the cognitive development that happens. So we've come out with a play framework in terms of trying to understand 4 different ways in which children are able to play, because there have been many play assessment frameworks which have talked about different kinds of play, like solitary play, cooperative play, dramatic play, and all of that. But here we are trying to make use of how the child is manipulating the object, how the child is interacting, and how the sequence of child being able to explore the object across different ages happen. So this, in this framework, what we are trying to do is how do children manage their bodies and space around them? Second, how do they use different things during play? Third, how do they use their imagination during play? And how do they play with others in their environment? So these are 4 different criteria we are using to come out with the play assessment framework. In terms of how do they manage their bodies and space around them, this is a dimension that gives us about how children's gross motor abilities, fine motor abilities, how do they sit, what is their posture, how do they understand. So this gives us an assessment of child's gross motor, largely gross motor and fine motor assessments. How do children use things during play? During play, children are able to transfer objects, use both objects. There's a lot of logic that infants use in terms of trying to understand the shape, size, and other characteristics of this object. So how do they combine this, and how do they use their attentional process, their executive functions, and all of this in terms of trying to understand. So we're trying to look into how this happens beginning from 6 months of age and at different ages of time. So these observations are very effective and simple observations that help us understand this is the criteria for trying to assess the cognitive development, the gross motor development. Then how do children also use their imagination during play? Because children imitate a lot of aspects in the environment around them. They use a lot of role play and dramatic play. So how does essentially imitation lead to imagination? There's a lot of imitation that happens in imagination play. So how does this happen, and how does this process facilitate cognitive, socio-emotional development in children? The last is how do they play with others in their environment, which is very important because there is a lot of humor child uses. There is a lot of aspects of guilt, shame. They try to understand in terms of they try to understand how sharing happens, pro-social behaviors happen. So these are 4 different ways in which we are trying to come out with the play assessment framework that helps us to try to understand and provide information to the parents and frontline workers to be able, which is very simple observations that helps us try to understand and give an overall idea that the child's cognitive development is happening quite well, and what kind of stimulation activities are necessary to facilitate and improve child's overall cognitive development. This is something that we have come out, and the one of the programs that we are trying to initiate essentially is also called as Project Bloom, where we are trying to bring out in terms of strengthening the community health systems and using family participatory care and improve maternal and parental health seeking behaviors, and also empowering the capacities of the healthcare workers by providing them with very simple tools that helps them to understand what is child's development and improve the child care delivery system in India overall. So essentially, capacity building of healthcare workers and parents is very important during the early childhood period. It should start from the neonatal period. So we are using a family participatory care model that was developed by Dr. Arti. In the neonatal period in RML Hospital, we are modifying and adapting that model to be able to track all the at-risk babies from birth to 6 years of age, so that it helps to decrease morbidities, neurodevelopmental morbidities in children overall. So this is kind of an overall brief of the programs that we have been doing in terms of starting from the neonatal period to the early childhood period and enhancing neurodevelopmental outcomes of children uh, from infancy, and trying to understand these processes that begin with and the child is coming with. Thank you so much, and thank you. I hope.
Sure.
I,
Thanks a lot, Dr. Madhuri. And you very rightly pointed out, I mean, you've actually educated us with how early infancy we could look at signs of intersensory perception and relate it to social emotional development in the later ages. And I appreciate the fact that you're working on this play assessment framework, and I can see applications it may have even in the context like we are right now in, which is actually a vulnerable context, and not just this pandemic, but any other vulnerable context like these. So I think we are ready to go now with more details on how we could uh, look at the issues that challenge the clinical conditions for the children who really are suffering from cognitive disorders, or who are vulnerable for cognitive disorders. So I would invite Dr. Venkateshan to give this talk on the clinical issues related to social emotional.
Good afternoon, one and all. Am I audible?
Yeah.
I have been given an onerous responsibility of covering a topic titled Social, Emotional, Cognitive Health of Children in this pandemic, especially those at risk for cognitive disorders. As a practicing clinician, um, earlier when with the pre-pandemic days, situations were different. Now during pandemic, the cases I see online or in virtual mode is totally different. But I'll try my best to cover what are the things, experiences we share with the parents and the children. I start with the prologue. It is not the load that breaks you down, it is the way you carry it. A wise man has said this, and I believe it's true. The objectives of my presentation today: one, to highlight the impacts on the social, emotional, cognitive health of children with cognitive disorders during the pandemic. Two, to examine the types and role of parenting on social, emotional, cognitive health of children with cognitive disorders during the pandemic. I'm talking of parents here. Second. Third is to offer short guidelines for ameliorating the situation for both the parents as well as the children. So, threefold objective is this. Let's start with cognitive disorders. Some of you might know it, but I just recapitulate for the sake of several students around there. What are cognitive disorders? Childhood cognitive disorders is a very heterogeneous group. They come in various shapes, various types, various degrees, various intensities, various diagnostic labels, and it's very tough to put them into one banner. But still, I've tried my best to say that all their higher mental functions are affected. It could be their sensation is affected, perception is affected, attention, concentration, imagination, thinking, concept formation. All these are affected in children with cognitive disorders. Are there any types of cognitive disorders? Yes. Most common that we see in our clinical practice is the intellectual and developmental disability, once upon a time called as mental retardation. Now it's not the right word to use. Autism is another very popular term nowadays. Specific learning disabilities, conduct and behavioral disorders, OCD, obsessive compulsive disorders, opposition disorders, attention deficit disorders, attention deficit hyperactivity disorders, speech and language disorders, or nowadays the new basket term we are using is or promoting is neurodevelopmental disorders. So these all come under that. What are the common signs and symptoms of this? The common signs and symptoms of these cognitive disorders are basically their cognitive processes are affected. That is, in terms of paying attention, sustaining attention, reasoning, planning, thinking, judgment, problem solving, all these are affected. Now, there is also an intellectual and adaptive behavior functioning that is affected. Many of these children, whatever name you call, whether you like to call it autism, ADD, ADHD, my experience is they all fall in the same basket of having developmental delays. They are sluggish. They are very much laggard compared to typical children of their own age. It could be in academics, it could be in social behavior, it could be in anything. Now, when it comes to the pandemic, what happens is these children are marked as high risk groups. Why? Even a day or even a hour's exposure in a very crowded place for these children is very, very dangerous. Dangerous not only because of their physical vulnerability, health vulnerability, but also their condition of not able to understand what's happening around them. So, especially those parents who are poor, who are daily wagers, who are migrants, and children of the institutionalized children who are left out in homes and who have comorbid health conditions. Some of them are bedridden, they are not ambulatory, they are wheelchair bound. What about them? Somebody has to hold their hands. Even when they walk, they have to bend. Or when they have to go anywhere, they have to touch people. And here the pandemic says touching is a taboo. So they are a very high risk group. And the danger is that they can even face fatalities if they are involved in all this. What are the areas of impact? Cognitive disorders have an impact not only on what we are talking today, but it impacts every area of their life: sensory area, motor area, physical area, social, emotional, and cognitive area. Of course, today we will be talking more about social, emotional, and cognitive impact. But otherwise, it's not that only three areas are affected. Overall, their whole life is kind of affected, and as well as those of people around them. Now, talking of sensory motor area, their five senses have to be in proper use, continuous use. They have to be motor activities have to be in use, fine motor and gross motor. And we find the pandemic imposes restrictions like you should not have physical contact. There is social distancing, And social distancing may become an excuse for social isolation. I've already come across many foreign cases where they have locked these children for fear that they should be. And what is being said is they are social distancing them, but I found they are socially secluded, which is very, very dangerous to their basic rights. Now, coming to activities of daily living, personal menstrual hygiene, for example, older girls with cognitive disorders, now it's a big challenge. Somebody has to be with them, somebody has to take care of them. Now, the mother has to do, or the other people have to do. If they are institutionalized, some institutional person has to do. There is a high risk of contacting the pandemic in any form in these people. And when it happens, it is fatal for these people. Now, periodic hand washing, mask wearing, or COVID etiquette as they call it nowadays, that is, you should not throat, throat clearing, coughing, nose cleaning, yawning, singing, sneezing, all this is kind of banned nowadays. Now, will these children understand all that? Can we make them to follow all that? Is a huge, huge challenge. Handshakes, hugs, sharing food is almost no. Now, these are some things our children are loving to do. I had a boy with Down syndrome who worked with me in my own department. Now we have stopped him from coming to the department, saying that he is a risk for himself as well as for us. Poor fellow, he's lost his job because he's so social. He mixes with everybody and he comes running to hug us. So I said, no, this is not good. Better you be at home. So the poor fellow has lost his job and we are waiting for the pandemic to get over so that he gets back his job. Now, this is a real life experience I am saying. I feel very sorry for him, but he was one very good attender for me. I keep telling people, but I have lost his services now. No, there's no other thing I can do and to save his life as well as ours. Now, let us see the direct impacts on our three areas. Social area, this is a very important area. The impact on the social domain is very apparent because that comes in front of us. There are high chances of these children being left behind, abused, or even abandoned. Imagine a migrant worker who called me and said, now what do I do with this child? Where will I take him for walk from all the way from South Bangalore to Bihar? Where will I take? Is there a place where I can abandon the boy and go? Then there was no other option that he had to be left in a police station. And then they said this is an abandoned child and they left for their places. Now that child was abandoned. Now then he is now growing in an orphanage out in Mysore here. There are also, this happens in a continuum, and I'm not saying all the children are abandoned like that. Some also take them along with them, and very difficult to carry them along here and there. And at the minimum, we can say minimum rehabilitation services have to be continued. Now, what has happened? Even I just stopped all the services. We were running a preschool here. The preschool is no more there. So we have stopped all that. The required medical consultations have ceased now. And then the parents have to go for low cost Ayurvedic, homeopathic treatment because they cannot ill afford all these high tech allopathic treatment. Now, girls and women with cognitive disorders are the greatest ones at risk. And that too in a country like ours, socioeconomic status, caste, religion, race, creed are the factors. Only yesterday, we had a medico-legal case of a tribal girl who was a victim of a rape and she's turned pregnant for the last 4 months. The alleged whoever was the culprit also was found out, but this girl who's having an intellectual disability could not say. And when it went to the hospital, then they made it a police case. The parents were against having a police case. They said we will somehow arrange it. But then the police case happened and it's become a POXO case where this girl doesn't even know that she is in. And you find the risk is coming more from people within the family. There are myths and misconceptions. In Karnataka, for example, where I am around, there is a misconception that these mentally challenged girls, if they are married off, the intellectual disability gets well. They become all right. So they come and ask me, now is the time, let us marry her off. And they find somebody to get them married off. And you can imagine the consequences of that. Social, there is a risk of neglect. In the house, even if they are within the house, there is a chance of understimulation. Nobody interacts with them. They are kept away. Even otherwise, non-pandemic days also they are understimulated. But when it is pandemic time, everybody is busy with themselves. Leisure activities, we have found in our studies, are very nominally made available to these children. In one of the studies, we found the average number of toys given to children with special need is less than 2 per child, less than 1 for girl child, and for the typical children it is almost 7 or 8, which itself is very low. And you can imagine during the pandemic the number of toys that are made available to these children. There, although the pandemic gives a lot of opportunities for family interaction, here we have the formula that closeness breeds contempt. I find that is what, the more they are close with these children, they find them contemptuous. They find it's a big headache to have these children. They may not say it so, but that is what the end feeling is. There is reduced social activity, and they, or sometimes the children over snack, overeat, and result into obesity or food refusal. I get all these cases with behavior problems of the pandemic induced. We have most children with cognitive disorder, they thrive on routines. They have a routine. For children, as we call those who are autistic, everything should be predictable, everything should happen in a routine. Something is upset here and there, they are very, the symptoms become worse, they aggravate. So now the pandemic has upturned everybody's routine upside down. There is a father staying in the house who was not staying earlier. The mother is always around when she was only half a day around. So the child is totally confused that what is happening around in the house is not as per the routine. There is no school now. Schools are closed. So there is no neighborhood play. There is no activity around. So all these new issues emerge, and they will create a lot of issues when the child is at home. Economic sustenance is also a major. There used to be a pension they used to get every month. Now, because of this pandemic, the local government has stopped giving these pensions, and these are the first casualty. They're not getting their pension regularly. They phone and call me, sir, what shall we do? Where do we get the pension? The government doesn't have money to pay the regular staffers. Where will they pay pension for the cerebral palsy child or multiply handicapped child, the below poverty line child? And we are here to give the certificate, but such certificate is of no value. So regular job is lost, part-time job is lost. Other social impacts are, there is a danger of contracting early marriage. That's what I was just saying. Domestic violence is on the increase, and these children being at home, and there are always people around nearby the house who take advantage of this. They are also having increased access to pornography, so you find the nearby relatives making use of these children. And I do get cases where they have been abused like anything, sexual abuse, physical abuse, all this, online abuse, offline abuse, photographs of these children, and these are all happening things in and around me. Just now ma'am was talking of play. Play is a very critical medium for social development. We have found there are stages of play, starting from self-absorbed solitary play to cooperative and competitive play. Most of our children, special children, do not come to that cooperative and competitive play. They are mostly in the solitary play level or pre-rule based level. Now, even that is lost. What I observe now, because there is nobody to play. There was a time at least the siblings were playing with them. Now the siblings are bored. They are not finding them any more attractive. In fact, the siblings are avoiding them. Which is, so you find there is no play activity going on for these children. Now quickly, let's go to the second area, the emotional reaction. Now emotional reactions are also very vividly seen in these children and their parents as well. I've seen here, lockdown, quarantine, and containment has generated loneliness, sadness, depression, irritability, fears, panic, anger, helplessness, boredom, a huge list I have given there. All this is happening both in these children as well as their caregivers. The children, for their part, are anxious, they are fearful. But what are they fearful? They don't know. Everybody talks about corona. Everybody, the TV keeps on showing a very dangerous picture out there every second, and these children don't understand. One girl comes and cries on the phone, uncle, this corona monster may come and eat me, or it may attack me. What should I do? The poor girl, a teenage girl with intellectual disability. So you find their sleep cycles are affected. They cannot sleep. The sleep cycle of the home is also affected because parents are also not sleeping as per the earlier routine. Now they sleep in a different time. The father who works from home sleeps at different time. So you find the sleep culture is also altered, and the lowered physical activity, sedentary life, does not fatigue these children, and they become more and more restless. And they, what is the option? They rush to the psychiatrist and they prescribe them medicines. Sedatives are given, saying that they are having an ADD or ADHD or a sleep disorder, and the sedatives are given and they are straitjacketed. So they have side effects. Again, they call up and ask me, what do we do with the side effect? So this is a very, very vicious cycle we are getting caught into. Very sad to say. And in case there is a COVID death in the family, which is also happening in odd cases, we find the adjustment to grief is very, very, very tough. Children don't understand. Why is it that their mother is not there or grandparents are dead and gone? And that too, the social ostracism that happens because of a COVID death in the family, what happens? Nobody kind of talks to them, nobody comes to them. So the funeral is not attended by people around. So I think these emotional reactions are widely not understood at all by these children. And the emotional reaction to the pandemic also varies depending on the type and extent of the exposure. What is the amount of support they get? Who is the one who offers them support? What is the extent of personal loss? What are the cultural issues out there? The community responses, and especially in the low and the lower classes, there's a lot of misconceptions about this, and there is a talk going on right in front of the child, which he barely understands. And the child's developmental age or stage is also a matter, their temperamental trait. So what I feel is the social impact and emotional impact is very intense, which is why they fear. There is a denial. There are stages I have observed in the emotional response. I have written here the stage 1 and stage 2 to cut it down short, starting from denial that there is no problem at all to a stage of acceptance. Parents have to undergo all through this, starting from denial, anger, bargaining, depression to accept. But acceptance is not easy. And there is a lot of things they have to go through till they come to the stage of acceptance. It is what is about the working through the emotional responses in a clinical setup. Now, the reactions in the stage wise, you find preschool children react in a different way, school age children react differently, and adolescents react differently. Preschool children, what they may show withdrawal, they are very quiet and silent, they don't mix with people, they show separation anxiety, tuck their mother's pillow all the time and be with the mother. Even to go to a toilet, they need somebody sitting with them, otherwise they don't go to the toilet. Things like that. That is preschool children. School children also, school age children have irritability, emotional constriction. That is, their emotions are not varied, and they have impaired attention, concentration. Their body tummy aches, headaches, all sorts of aches and pains become increased. Some of them become obsessive. Adolescents usually react with depression, but the depression will not show as depression. They show as aggression. But the treatment should be given for the depression. They require an antidepressant treatment rather than an aggression treatment, because they are unable to accept the depression in themselves because of their self-identity issue. This is there. And they will be put on drugs, unfortunately. Now, the emotional reaction, direct exposure to the pandemic, or self or other perception about it may not be really there. What they see and hear, that makes them to, and the perception is all around. Everybody keeps on conveying right or wrong messages. Somebody says on the TV that the world is coming to an end, that there are floods coming up, adding trouble to our situation. Eclipses regularly happening, and there is some Swamiji or Guruji coming and telling that the end of the world is tomorrow, and the child hears that, and he asks whether I'll die tomorrow, whether our family will die tomorrow. So this is a practical situation that I am seeing day in and out, and their anxieties. Mass media is a culprit out here. Rather than giving the right information, they hype up all this. Resilience is another. The ability to bounce back is very tough on them. Their ability to absorb, accommodate, and recover from all this is very, very tough. Face masks. We use face masks, and hardly we can see what is behind the mask. I can't read out what are the emotions. You imagine the child with cognitive difficulty. Can he make out even otherwise also reading the faces and body language is very tough on him. Whether you are angry or smiling, it's very tough to make out with a face mask. Problem behaviors I get day in and day out in the phone-in programs, the radio programs we are doing of late. Everybody complains of problem behavior. Child is having this problem behavior, that problem behavior. They are all the time complaining about the child. Sometimes I've gone to the extent of thinking whether the problem is there in the child or the problem is there in the parents. And I've started getting convinced more and more the problem is in the parenting rather than in the child. They don't know how to handle. Not blaming them. They are unable to handle. And the not handling them makes the child inattentive, angry, and all that. And they are restless. And the parents also communicate all this to them. So if the triggers are happening, cues are there, house is locked, people are not going out, everything is happening, rewards are not given. All this is clearly impacting on the problem behavior. That's what I just mentioned. Parenting in the COVID times is totally different. As such, parenting special children is a huge challenge. Parenting, I've recently made a study where I found trends of hyper parenting and hypo parenting and atypical forms of parenting emerging. For example, hyper parenting is over involved. Now that they have all the time in there, all the time they want the children to sit and study, study, study. Now the children cannot sit and study all the time. Hypo-parenting, or they're bindas. I mean, they don't care whatever you do. I'm not bothered. Atypical forms of parenting are happening. The father is in the US, the mother is here with the child, and the father talks to the child online, and the child has to content meeting the father on virtual. Or there is a Friday weekend father, virtual father, and virtual father will be threatening the child. All this is atypical forms of. Sometimes parents have handed over these children to the grandparent, and the grandparents have to relive the life and start parenting these children once again. So I kind of experience all these clinical calls every day. Very tough for me to also handle. Their leisure time activities have all come down to minimum. As such, leisure time activities for special children are very low, and now there is no leisure time. So I feel all this is boiling down to attitudinal barrier. The home problem behaviors intervention is required. They come with the support, and we are offering through radio calls and all that, but it's a huge challenge. Cognitive area. Cognitive area, social distancing is poorly understood by these children. They cannot configure what is the coronavirus because they see the monster spike all the time on the TV. They think there is a corona coming out there on the door and then it will attack the child and I am going to die because of it. The visuals and the talk of it all the time on TV is really creating a problem on it. And the children have their own wrong beliefs. They have their myths, misconceptions, prejudice, and their doubts and suspicions are increasing. Have I done something wrong? Am I to blame? Have I caused all this? Will my father and mother die? Can we correct all this? These are the questions they ask us. And the kids visualize their enemies vividly. They hear them talk. When we cannot end calling them as having hallucination, but that is the child's way of responding to it. And their hypervigilance and hyperarousal makes them to have bedwetting, thumb sucking, increased soiling, no sleep, or an initiation of sleep is affected, or refusing to remain alone. Somatic symptoms are on the increase, body aches, headaches, and even cognitive decline is happening. And we have found the long-term impacts, how it is going to be something we have to wait and watch. We have seen long-term impacts of the earlier pandemics, short or not so big a pandemic, the SARS and all. We can assume the COVID also is likely to have cognitive fatigue. It's only a guesstimate that there might be neuromuscular weakness, cognitive fatigability, or post-traumatic stress, all this happening. And you must also keep in mind the development stage of reality and fantasy. As an adult, we are more close to reality. Children are more close to fantasy. And what they see of the pandemic is of fantasy. And their limited spatial orientation, what they see is what they believe. Their magical thinking, wishful thinking, here and now thinking, and limited time frame that they have, they only know of the now. They may not know after 1 hour, they may not know after 10 days. So it's very tough for them to understand after a month things will be better, or after 1 hour you will get something. So they are on a concrete level of thinking, literal level of thinking. They won't understand cause and effect. And parents try to explain all this through adult mode. They neither have logical thinking, neither they have illogical thinking. They have paralogical or translogical thinking. Parents don't understand that how to. Language development. Keep in mind that 3-year-olds have a very limited vocabulary. 5-year-olds have another limited vocabulary. Compared to adults talking with a high level vocab, the child can't understand. Closure of schools have had an impact also. Children with specific learning disability are without school. There are no coaching centers now. Otherwise, earlier there used to be coaching centers, they used to charge them and then they used to take them. No such things are available. They are at home. And what to do, they too don't know, the parents too don't know. And the first choice is the parents are looking for online, offline courses, try to keep them busy with gadgets, which is again very dangerous. The cognitive overload and creates a lot of issues like refusal behavior, avoidance behavior, negative behavior. What I'm seeing is all these are happening in every household. The pertinent question to ask here is, are they the cause or consequence of the condition? Are they symbolic expression of the sign of seeking help? The child is asking for help. I'll quickly close my presentation by adding one or two slides on short note on interventions. Of course, there's no time to go detail for that. What we are trying to do at best is, given the constraints we have, social, cognitive, and emotional health is very as important as physical health. We are working on a daily kind of consultation and daily kind of help also is be given. We call it a psychological first aid, where we make them to, we look at them, listen to them, and link with them. That is the first. And most often the parents simply talk to us, ventilate itself is very cathartic. They say, it's good sir, we talk to you and we are feeling better. So I think there's nothing much of talking to them or giving suggestions. Listening to them itself works a lot. We give them ideas about stress busters, what they can do, how, especially when there is a COVID death and there is a special child in the family, there is a lot of extra effort we need to put, and that is also being done. But the whole atmosphere should be safe, supportive, and consistent. Relations should be available. In many cases, the relationships are not available. The father deserts the house and goes away because he cannot face the landlord and pay the rent, and the mother is left with a special child at home. So this is a very, very dangerous thing that's happening every day out here. So healthy development requires all these relationships. To conclude, the regular body exercise is required, but there is no place to go for exercise. There is no place they can go out. They cannot go to the park. They cannot. They can at the best go to the terrace. If they are in a single room tenant house, where will they go to house? So they are locked in the room. And where there is a power cut, the child is in dark and he doesn't understand there's a power cut. The mother phones and calls me and says, what do I do? How to tell the child there is a power cut?
Request you to summarize, Dr. Venkatesan, please.
So these are the issues, and what is happening is these are the problem. Access is also very less. Public health information is also given to regular people, but special people related information, write-ups or articles on papers and all, very, very minimal. I'll stop with giving one line epilogue. There are far better things ahead than any we leave behind. So, in this positive note, I think we will be able to attempt answering some of these issues when it comes to children with special needs. A huge, huge challenge. We don't have answers for that. If at all we can come out with some, I'll be very happy at the end of this seminar. Thank you for listening to me.
Thank you, Dr. Venkatesan. You very clearly pointed out what kind of challenges different children, children with different cognitive disorders may have. And these could be in the three domains, as you mentioned, social, emotional, and cognitive. Obviously, there is information load for children, especially who are suffering from clinical conditions. And we as caregivers, as you rightly said, that we need to redefine the ways we have been approaching these issues in children. And definitely we need to accept that that is the challenge we have, and we need to come up with more redefined ways of approaching treatments and therapies, or just getting across the kind of interventions that would be required in the in such vulnerable contexts, because this is going to be there for quite some time. And the post-pandemic era would be even more challenging. So three talks, and I will just quickly say something and maybe just raise one discussion point because we are short of time now. So we have talked about as perhaps an unemotional, and I really like this terminology that you used today. And we also have looked into the relationship between social and emotional skills, the social information process, how social is linked to emotional literacy, and maybe Nandini would be happy to know that when we look at the effect of, or when we look at the relationship between cognition and emotions, studies one and adults, one has to emphasize processing, find that positive affect has shown a great impact on how children can exercise their top-down control mechanisms. I'm referring to attentional control. Whereas adolescents, it is more of the negative affect because they are more sensitive to negative affect. And this is something which you see if you really, we've also done some aging studies. This gets back in old age, where old age again people actually show the effect of positive affect bias, and that is something which is relevant, or which is interesting, just to see how across age things actually may vary in terms of the emphasis on the positive affect and how it can shape our cognition. Now, one relevant question that I want to put forth to all the speakers, and any one of you may choose to respond, is that we've been talking about the effects of pandemic or social isolation on social, emotional, cognitive skills. But how long term do you see this effect is going to be? Will it affect development, or is it something which children will outgrow and the experience may probably stay for some time? Or is it really going to affect on how they show up in terms of learning, or in terms of acquiring information, or even social interactions, social perception rather? So that is one. And Nandini, to you specifically, when you talk about digital platforms, we see that shift. This is more like a paradigm shift now for all of us, whether it is research or whether it is intervention. And if we are shifting to digital platforms, what kind, in your experience, what kind of effectiveness you see of these digital platforms, how conducive they could be to deal with such vulnerable contexts as well, and also in general. So I'm just putting these two discussion questions, which I would just request either Nandini or any of the other two speakers to respond to.
I think Madhuri should take the first one.
Okay. So Madhuri, would you like to respond to this? How long-term could be the effects of the social isolation that we can see? Because you have been working with infants as well as early childhood. So do you think that early childhood cognitive development will show an effect for the infants who are growing in this environment today?
Yes. Let me give you, because when we are working with children in the neonatal ward, there is a well baby clinic where these infants keep coming regularly, about once in a month. So there is an early intervention process that's happening quite early on, and mothers are being provided the kind of intervention that they need to practice. It's been almost 3 months now in RML hospital that these mothers are unable to come to the well baby clinic for providing early intervention services. And especially for children at risk in the earliest periods from 3 months, it is extremely important. Every day of the child, as the first 2 years, and Nandini knows it quite well as a neuroscientist, the first 2 years being so significant for the brain development and overall neurodevelopment of the child. This is something, it depends on the age of the child. The at-risk factors that the child is born with has long-lasting impacts, and how these impacts are going to show at different ages is going to be different. If it is quite early on when the brain development is happening, and it requires a lot of the caregivers input and many interventions to be supported by the community, by specialists, and by all of them, then it might have a long lasting impact. on the child itself. Because as it is, it's a big challenge for parents to bring them to the early intervention center. And now with this pandemic, it's an additional um, burden on them to be able to come to the centers. So center-based early intervention practices, that is why in our interventions, what we want to focus is to strengthen the community healthcare system so that this community health workers can be able to deliver these services to the mothers, both in the urban rural areas where primary health centers and Anganwadi centers and our healthcare centers are already in there. So I mean, I would feel that the age of the child has its long lasting impact. Suppose if it is for a child who has problems at 7 or 8 years, that I think Dr. Venkatesan can be a much better person to answer at a much later stage what would happen in Nandini during the adolescent period as such. But I would speak much more during the early periods. It has significant effects that could have an impact, and what the impact is going to be needs to be studied, especially so because we do not have any evidence at the moment of what's happening within the homes and how this is happening. So it seems to be um,
Yeah, sure. I mean, it's quite early for us to predict anything because the studies are still to go. And
yes,
the longitudinal design, I mean, longitudinal framework is probably the only way to really find answers to these
yeah,
questions. But
yeah. There
yeah,
is
Dr.
also
Nandi, you may
resilience
want to.
factors right now also, right? There is also resilience, right? Parents are there with the child.
Yeah, yeah, sure.
That's there as well.
So
So
that's
we can
the only
counteract
thing
that
we
effect.
could tap on.
I
True,
think
true.
you already answered most
Yes,
of it
yeah.
between Madhuri and Bhumika that we really don't have too many longitudinal studies of such unique scenarios. But given
Yeah.
what we know from cross-sectional data that has emerged from different age groups, that if we are able to provide enriched environments at home where we are able to provide within the family settings, social atmospheres, and safe spaces where parents are able to devote that kind of time, I think children, the resilience will kick in and we might not see such dramatic effects. The big question we need to ask ourselves is how many people can afford to do that? Okay? If parents are bread earners and doing that, who does this? Okay, can extended family actually begin to provide that? And some of the worrisome factors are that the easiest thing is to just hand in the digital device to the child. Okay? Now that's a completely different ball game that has opened up now a Pandora's box, and again there is very limited data.
निकल गया ना जल्दी लगाइए जल्दी
Two things
इधर मत
that
दौड़िए
know that have been shown in the data are, and we know this because recently we did a review of that, is
ना इधर
extended
नहीं बेटा इधर नहीं
devices
ना
does not really impact
Yes.
behavior that much, but there are studies that show that it could impact brain development at specific ages. What we are finding based on the implementations that we do, that in the earlier age groups up to say age 12, certainly the teacher or the human involvement plays a very important role in building social and emotional skills. So it's probably more important to empower the teacher and the parents to do that. But we are living now also in a world of digital natives, and a lot of kids are spending increasingly amount of time on their devices. If there is a way that this could be supervised and managed right, we actually have an opportunity where we can use these to build in the relevance of interactions, begin to encourage more peer dialogue, expose children to more interculturally rich narratives to be able to build their social and emotional skills. One of the most exciting things we have seen is how children recognize a lot of these skills when they're playing a game, even as opposed to when you explicitly tell them.
Yeah.
And there are very interesting gender differences that we actually see. So this is a very emerging area. So We don't really have all the answers. But I also think we are in very unique positions to start designing some very interesting studies with the right amount of controls, both at, controls in terms of control population, controls in terms of digital controls, how much of the device you're using, and maybe have some more answers emerge over a period of time. But the digital is here to stay. That
Yeah.
thing can be denied. It is
Now
now
even researchers have to.
how to use it most effectively for our benefits.
Sure. So I think I recently saw an announcement for a workshop on online experimentation. So I
Yes.
think people are thinking about, and we have been really worried about that, that how to really make it as effective and controlled as possible. I mean, when we really get to human participants on online platforms and doing
Yeah.
experiments, it's going to be exciting but challenging at the same time.
Very.
So as you said, yes, digital platform definitely gives us an opportunity to make create more interactive platforms where probably learning can be much better. And as we have seen, I mean, just to give a short example of theory of mind experiments, whenever they were made more interactive, you have seen early development of theory of mind. So that is something which definitely gives us a unique opportunity, as you rightly said. Dr. Venkateshan, would you like to add anything
Yeah, yeah.
else
I
to
have.
conclude the
In
session?
as much we may wish,
Yeah,
I for one strongly feel the clock cannot be turned back. There will be
yeah,
no more a time again when patients will come and see me, sit across the table. I will see children, their parents. I think we are going to move into a different mode, which already we have done, and there will be a virtual mode only. And children also will be seen virtually, parents also will be seen virtually. Everything will happen in that mode only. So we should be prepared for that. And as psychologists, I feel we must move ahead with time and also turn. On the one hand, it's a very tricky act because it's like a trapeze artist. You can fall this side. One side we say screen time should be limited. Too much screen time for children is risky, dangerous. We have a shut clinic in Nimans which works for preventing children from getting addicted to correct. But again, on the other side, we say children have to be taught. And I have my own grandson who's all the time hanging on to nursery rhymes and all that. And I find it very uneasy to see a small 1 year old all the time on this, and he's never seeing us on real mode. So what I'm trying to say is it's a very difficult time. None of us knows the answer, but the only alternative now we have is the virtual mode. Probably that, but that should not be the end of it. Probably there can be
sure.
better days, let's hope. But I am for certain that we will never get back to the older version, because there will be always a doubt that I will be infected, they will be infected. Why should we allow them inside my room? Why should he sit next to me? So I think children mixing with each other, talking to each other, distancing of children, special children particularly, and that to these children all the time, the side with cerebral palsy will be always dribbling and drooling, a very risky group, but they need that. We can't take them in. So I think it's going to be a huge challenge. We need to research on this. No black and white answer can be given.
Yeah. So I think the efforts have to be in the right direction, which are more practical, regulated, and how best we could achieve the outcomes. The only thing is that what I think today's discussion has been really nice in the sense that we have covered age, we have covered three domains. I mean, to some extent, because obviously in this much time we cannot do justice to everything in detail, and we've also gone to through certain clinical aspects. So what gives as a concept, I mean, what gives as a cohesive, you can say, framework is that definitely we have understood which social, emotional, cognitive skills we are really referring to in today's time, and it just makes us more vigilant and probably aware that we should be just sensitive to what are the needs today, and not just try to use things which probably were working well in a different context earlier, and now, as Dr. Venkateshan said, we need to definitely come up with new interventions and which would be more conducive to today's context. Uh, the, I mean, the positive thing that I see is that all of us have talked about resilience. All of us agree on the fact that so these are the two, I think, buzzwords which we can say today. One is resilience, the other is adaptation, which is related to that. And This could be in any of the three more domains that we referred to, whether it is social, emotional, or cognitive. And it is true for adults as well as children, because even as adults, I think we are also learning how to deal with the current stressful situation. And as professionals, we are expected to do more. So whether it is through research or through practice, and that is something where I think uh, probably we will design studies which are conscious about the fact that we look into the mechanisms of building resilience, and as Nandini has already started on that line. So probably I would look forward to what findings you really would share in the future course of time. So Dr. Madhuri, you had something to say, otherwise we can thank him.
So, what
Okay.
I wanted to add also was with the communities staying in marginalized communities, they do not have access to a lot of virtual smartphone or any, especially with 11% of families in India just having internet access. But 11, or I think some, I mean, in urban India it's 40, in rural India it's about 11% of that. So that is one of the major challenge for us to be able to shift from, not being from to the virtual media as well. So when we are working in the communities, we know when in an Anganwadi center, when we are visiting, we know that right now these frontline workers have been engaged so much in taking care of the pandemic and collecting data for pandemic, whereas their main
Sure.
role being able to deliver childcare services. But these families and mothers do not have enough resources to be able. So, in that kind of a situation and a setting, it's a bigger challenge in India, especially keeping in view the urban, rural, socio-economic, all of this inequalities that are there and that divides the children the right to access to play and right to access to be able to build up these kind of parental resilience processes that are important. So, I mean, right now, because of our work in the with the frontline workers, we have seen frontline workers not being able to deliver as much. That's one point I wanted to add. Yeah.
Okay, thank you so much. So I think let's conclude here. We had a nice discussion, and I hope some of us will collaborate on something like this, looking at cognitive emotional resilience and activity. And I mean, although there are challenges, but I would like to end with a positive note that we have a lot of opportunity here to look into the mechanisms more closely, I think. So this has also given us that kind of a platform. So thank you so much, all the speakers. It has been great having you here and really learned a lot from all three of you. And hope, I mean, all the best for our research in future. I mean, I know all of us are into research and obviously practice as well. So thank you so much, and thanks a lot the participants who have joined us today. Hope you enjoyed the session and we had some learning points to take forward. Thank you.
Thank you.
Stay well, stay safe.
Yeah, stay safe.
Bye-bye.
Stay safe so that we can do more work.
Thank you. Thank you.
Okay. Thank you.
Thank you. Thank you.